Good morning, everyone. I'm Mike Leader, President and Chairman and CEO of Country Meadows Retirement Communities in Hershey, Pennsylvania, based in Hershey. And it's a beautiful morning in Hershey. So if you're watching live, you already know that. If not, I hope it's a beautiful morning wherever and whenever you're watching. We're going to talk about SARS-CoV-19 this morning. When SARS-CoV-19 was first identified, out on the West Coast, well, in China, I guess, but when it came to the United States, on the West Coast in a nursing home in Kirkland, it was obviously a serious issue because people were dying there. But it was preposterous to think that SARS-CoV-19 could kill as many people and have as many victims as the Spanish flu in 1918. That was 675,000 people. And that was just here in the United States, and around the world, it was believed that as many as 50 million people died. Although more serious than a common cold, coronavirus circulates every winter, along with the other cold and viruses that go around our country. And preventive medicine has come a long way since 1918. So at Country Meadows, we were fairly confident that we were prepared for COVID-19 when it came east. After all, we were good at controlling the spread of seasonal flu among our residents by facilitating annual flu vaccinations. We're proud of the fact that a high percentage of our residents and our coworkers receive annual flu vaccinations. And if the flu did present itself on campus, we suspended visits, isolated any resident with symptoms, and treated them with a 10-day course of Tamiflu. And Tamiflu is an antiviral medication. In addition to those precautions, our coworkers wore masks. They would also wear gowns and gloves, and they would isolate from anyone who was diagnosed with COVID-19 unless they were treating them. So how much worse could COVID-19 be? A lot worse, it turned out. COVID-19 turned out to be far more contagious than any virus that we had experienced. Worse yet, confusion and disagreement raged on how to fight it. Whether mask-wearing mandates, school closings, mandatory lockdowns, or the best form of treatment, opinions varied, and politics amplified those disagreements. You already know the outcome. Tens of thousands and perhaps hundreds of thousands of people have perished because of the way that we have addressed COVID-19 in this country. And a high proportion of those victims have been older persons. Seniors continue to be the most vulnerable. We've seen the list of health conditions that raise the risk of life-threatening symptoms of COVID-19. We still aren't sure why some people become infected while others don't. Researchers have indicated that some blood types are less susceptible. I think it's O positive, and I happen to be an O positive. And also that perhaps a case of a milder form of coronavirus has raised antibodies that make a person less susceptible to getting the disease. But we found that all but the most isolated people, even those who have had it before, are at risk of becoming infected. Yesterday, the total number of cases in the U.S. stood at 48,990,000. Deaths were a staggering 782,000, already far more than 1918. But that number is actually too low, because we know that many people have been infected with COVID-19 who were never tested, diagnosed, treated, or reported. The COVID toll goes far beyond those infected. Healthcare workers have suffered immeasurably, as have family members of those who have become ill. Many healthcare workers who've been regularly working 12 or 16 hours straight in hospitals or nursing homes have burned out and left the profession. I can say for a fact that we know that at Country Meadows, at our 11 campuses, we've lost some outstanding coworkers, people who have served for a long time because they've just burned out. And it can take a long time to recruit, train, and integrate someone into a really good healthcare team at any level of healthcare. And it's going to take years to restore that level of competence and commitment that we've lost from these people who've left our profession. To give you more perspective on the impact of COVID-19, I'd like to introduce President and Chief Operating of Country Meadows. Meredith Mills and her husband Dan, both Hershey natives, joined the Leader family business over 10 years ago. And Meredith comes into the third generation of this business. Meredith is the daughter of my sister Jane and her husband Ted Janicek. During the years that she has been with us, she has been a campus director of marketing, a regional marketing director, a campus executive director, and corporate vice president of strategic planning. 3 years ago, she became president and chief operating officer. Meredith is an outstanding young woman and an outstanding leader, and she's been on the front line of our approach and our response to the COVID-19 pandemic during her time as chief operating officer. It's my pleasure to introduce to you Meredith Janicek. Get it off there, Meredith. Sure.
Thank you so much. As Michael said, I came into the Chief Operating Officer role just in time to lead us through a very challenging period as a business. And although I don't think any of us want to go back through the year 2020, I think that as Christians, we have an opportunity to examine some of the moral and ethical obligations that we have, and in particular, how we can continue to protect fragile and vulnerable populations like our older adults. And I'd like to share a little bit with you about what we learned through protecting our older adult population throughout 2020 and 2021. First, I just wanted to take a moment to talk about Country Meadows as a company. Although many of you know us as your local neighbor and a local business, we actually are one of the 50 largest senior living providers in the country, and we operate 11 locations in Pennsylvania and Maryland with over 2,500 residents, as we call them, not customers or patients, and about as many coworkers across those locations. We provide assisted living, independent living, and skilled nursing services. And as Michael mentioned, we remain a 100% family-owned and operated business. So just a little throwback to 2020. I think especially healthcare workers don't want to go back there, and certainly it's a little painful for us to review it with you, but I think it's also important as we speak about what the overall public was experiencing versus what healthcare workers and in particular senior living providers were experiencing, because we got a very intimate look at the way this virus was traveling, the way it behaved, and what we need to do to end this pandemic. So just going into a little detail, Michael mentioned that in November 2019 is when we first saw COVID-19 emerge in China. And it wasn't until early 2020 that we saw our first case in the West Coast in Washington. But it was very apparent to organizations like Country Meadows at that point that we were going to be a target and that our older adults were even more at risk than the general public as we faced this concerning pandemic. At the same time, we started to prepare by forming an internal COVID task force and making sure that our campus leadership had daily updates so that we could get ahead of some of the concerns and challenges that were coming through the news and let them know that we had a plan, that we were listening to their concerns, and that we were ready to lead through this. After the first death in February and the World Health Organization declaring a pandemic, we quickly saw our guidance turn to visitation shutting down for all of our residents, which I'm sure you can imagine was extremely frightening for them, being cut off from their families. And actually, our regulating bodies required us to have all of our residents go to their apartments and receive their activities and meals there. We quickly pivoted and were able to still deliver our great meals and even our activities and spiritual services through in-room closed circuit television. So we were able to broadcast our activities and our church services and all those things to our residents in their rooms, which I think helped them really stay connected during such a time of isolation. We also made sure that we planned all kinds of FaceTime opportunities with their families. So we quickly deployed many, many iPads to ensure that they were able to interact with their families. Their families could see them even when they couldn't be with them. But it still was obviously a very frightening time for them as they knew this virus was specifically targeting seniors. And then to ensure that our coworkers, who were also very frightened, knew that we had their backs and that we would continue to protect and support them, we ensured that we elevated all of our coworkers' level of pay during that time, and we started appreciation pay to give them enhanced pay during the pandemic. So by the time that we reached March, we already had several tactics and strategies in place to support our teams, but it would be a few more weeks until we started experiencing the virus firsthand. So in April, the world surpassed 1 million COVID-19 infections. And at the same time, we were experiencing our very first outbreak. And what we learned very quickly was that our residents who lived in secure dementia neighborhoods, who didn't understand what was going on, were not interested in wearing a mask, and were not compliant with staying in their apartments, were really our most vulnerable, because they were still having close contact with one another, and seeing their doctors, going out to healthcare settings, and were very vulnerable to getting this virus because they weren't participating in some of the safeguards. So at the time, we had an infection challenge in our Maryland location, and the Department of Health said to us, we can't get any testing kits. So you just have to assume that anyone who has symptoms is positive. Well, that was very challenging considering the symptoms were continuing to change as well. And some of our residents just had fatigue and ended up being positive. None of the cough and sore throat and things that we had heard about. At the same time, hospitals were worried about becoming overrun. And so in all of our locations, they were sending residents right back to us and saying, keep them in your setting. We can't handle them. We can't become overrun with patient needs, which was very challenging for us because although we practice strong infection control, we've never been at the level of a hospital where we have the negative pressure rooms and things of that nature that would have been most safe at this time. So by mid-April, almost all of America was under lockdown. I'm sure we all remember that, the work from home orders and shelter in place. And at the same time, PPE was extremely difficult to get. We have worn masks, during flu season and during certain infectious periods, but mostly we don't use excessive masks and gowns, and we were lucky to have some on hand that we had stored up for a pandemic like this, but the hospitals became first priority in the supply chain, and we were limited in what we were able to order and had to go through some very creative paths in order to get masks. And at the same time, the CDC started recommending that all Americans wear masks. So right away, we were worried about the availability of masks to our own staff. But at the same time, we were lucky that our leadership said, do whatever you can, be creative, think outside the box, use whatever funds we need to protect our residents and our coworkers. And we were able to go through some long-standing relationships in China through a business that we used as a partner in order to get adequate PPE for our teams. We were able to even get HVAC systems that ionized and cleaned our air, electrostatic sprayers like you may have seen at airports and things, and the UVA disinfection systems that you may have seen on the New York City Transit cars. So we really felt that within another 6 to 8 weeks, we had really good infection control, but we still didn't have adequate testing to be able to contact trace and really see where some of our weaknesses were. By May, after again some creative problem solving, we had access to testing with a 48-hour turnaround. And that was a real game changer for us because I think what was not known to the general public was the incredible amount of completely asymptomatic spreaders. And so when we had adequate access to testing and we had a few cases at one of our central PA locations, we were able to test the entire population of residents and staff. And for the first time, we were able to isolate and stop the disease in its spread and remove people who never became symptomatic from the workforce who were positive. So that was a real game changer for us, and we were lucky that we were able to get that through some creative support. Meanwhile, we were under the direction of about 4 different regulatory bodies telling us various directions that we should, we should head with policies and isolation of our residents. But luckily, we were able to already get ahead of many of those guidances because of our insight and the fact that we have 3 former hospital chief nursing officers on our leadership team. They were well ahead of even what the government was telling us to do. And by the time in June, when the Pennsylvania Department of Health asked us to do universal testing of all of our staff, we had already been doing that for months, or excuse me, for weeks, actually, a little bit over 6 weeks. By July, we got even more creative and said, we're aware that when we find a case, it spreads very quickly, and we need to test and identify and remove the source. And so what we were able to do was set up a COVID positive unit that was completely separate, with separate staff, separate entrances at one of our central PA locations and at one of our Lehigh Valley locations. And we were able to test immediately when we had any symptoms and send any positive residents to that safe place to recover and to limit the spread to any other residents or staff members, which again was a huge lifesaver, and we're endlessly grateful to the staff that was willing to support those units. By the time the US deaths were topping 200,000 in September, we already felt like we had a great system down for protecting our residents, but we didn't know what was to come with the holidays. And unfortunately, the vaccines were still hanging in the wait, and we were really just hopeful and taking it day by day until the vaccines would come, because we knew that was the real hope for an end to this and the real ability to control it. We were able to bring on even more rapid testing by the time the holidays came around, so we could have a result in 15 minutes. But again, as the holidays approached, we saw those surges that came, and it was very heartbreaking to have to shut down visitation right before the holidays for our residents. And really, God bless our residents and our families who said, we trust you and we know what you're doing is to protect everyone, and they respected that. But it was a very hard time for our residents, as our coworkers were their family during that holiday. So as global cases topped 50 million, we moved into that time of hope. And as Christmas came around in 2020, I kept thinking of the Christmas hymn that says, "The thrill of hope, a weary world rejoices." And as news of the vaccine came, we truly were grateful and rejoicing in knowing that there was some hope coming to us, that this could be drawing to an end. And unfortunately, although the vaccine was cleared by December 18th in the US, we didn't have access to that until about mid-January. Again, our friends in the government moved as quickly as they could, but it was challenging to wait those weeks as we saw cases spike and rise throughout the country. And we were able to get our first resident and staff vaccinations in mid-January. Interestingly, I have a little chart here, and it's a little bit difficult to see the dates, but it starts at March 20th, 2020, and goes to April 8th, 2021. And if you can see the spike when the pandemic first began over here. So this is April, May 2020, when we really had no or little testing and very little PPE access. And this is actually a chart of total reported COVID-associated deaths among all skilled nursing facilities and assisted living facilities in Pennsylvania. And then you see things calm down over the summer as the warm weather and people moving outdoors and people complying with masking began. But then we move back into November of that year, right before the vaccine, and unfortunately we see that spike happen again. And this is, again, all facilities within Pennsylvania. But as our first vaccine clinic and many others' first vaccine clinics began here in late December, early January, you see this sudden drop off. So you can really see how the vaccine positively affected our residents and even our coworkers. It helped them to stop the spread as well. So when we look back at the pandemic and we see what we learned as an organization, there was so much frustration with, the guidance of the government, but even more so, I think, with the politics involved, and that overtook sometimes the moral obligation to some of our most weak and most vulnerable populations. We heard about outbreaks in meatpacking plants where we often know immigrants are working, or low-income individuals without educations who have to work in those types of settings to earn an income for their families, or prison settings where we know we have people who already are struggling in life and then were made very vulnerable to a disease outbreak because of their proximity to one another. But also our older adults, to no fault of their own, they were the most vulnerable to this disease. And the whole idea of ageism and perhaps not as much reverence for our older adults came through in some of the decisions that people made politically, or some of the decisions people made morally when they decided or decided not to become vaccinated when that was available. But it really became a challenge for us because we were fighting so hard and our coworkers were fighting so hard to protect our residents, and sometimes we felt like the rest of the world was working against us because there was just sometimes a lack of focus on who was dying in this. Telehealth became a very interesting opportunity, though, in our healthcare system. When we know how expensive healthcare is in the United States, it became a missing tool that we saw arise to provide more equitable care to people in rural settings or people without adequate specialists in the area. The rules around telehealth were loosened greatly during the pandemic. And although we've been using telehealth as an organization for many years, we saw a lot more older adults and just the population in general have access to telehealth resources that really were game changers in terms of making things like psychiatrists or specialists available to people in areas that don't have those specialists. And the effects of isolation on the elderly was really something that I think we fought through a lot, thinking, are we protecting people from this virus while we're also affecting them so heavily emotionally and socially? We saw some of our residents who were in their apartments or were isolated from their families for many weeks or months grow weak and lose some hope because of that connection. And for some of our residents who don't have as many years left in their lives, it was very difficult for them to lose that connection with their loved ones. But we also really enjoyed the opportunity to reconnect them with that as soon as the vaccine came around. And it was a really special moment to see the life come back into them as their families came into our buildings and as they were able to go out for meals with their families and enjoy Easter with their families and enjoy some of those important holidays again. And it really reminded us all about the importance of our health in a spiritual and emotional and social way, and not just a physical way. The lack of clear communication and trust in science from government leadership was also something that I think came to light for us in a way that those of us in the healthcare community didn't expect. If you look at the statistics and you see that every single living or former or current US president is vaccinated, 97% of physicians are vaccinated. When you look at some of the statistics, it's difficult to believe that some people still don't trust the science. And it was scary for our coworkers also, I think, in the beginning, because they thought, well, how are we the test subjects? This is a new vaccination. It was developed at a speed that was unbelievable, although if you read the research, it really was just the first time that a global scientific community came together with all their resources and money at once to fight something so big. And that's why we were able to move so quickly. It was a challenge to get our coworkers to trust and get our coworkers to be a part of this solution. And we're so pleased that today we can say that 75% of our coworkers are vaccinated. And that's without even having a mandate. That's just with having conversations and encouraging them. And at the same time, 99% of our residents are. So we've reached a real level of herd immunity. in our organization. We also learned that infection strategies really work. We looked to best practices. We were lucky that we had clinicians on our leadership team who had done this before, or at least had done emergency preparedness drills of this nature to prepare for this type of thing. And we were well ahead of many of our peers with these infection control strategies that we know historically work, and we were able to deploy them right away. And now senior living communities are some of the safest places that you can live and work because we have such a high vaccination rate and we're deploying so many of these strategies day to day. But also, I think as a country in particular, we saw the infrastructure of caregiving and how delicate it really is as people had to stay home and then figure out alternate working situations and figure out challenges with maybe caregiving for an older parent or relative and maybe being fearful that they were going to bring something into their older relative's home and life that could be detrimental. We all started to think about how we care for our older adults and how we care for our children and what type of infrastructure our country has to support that. When Michael talked about some of our workforce that has left, our average coworker is in her late 20s and has children. And we have seen, unlike in the restaurant and hospitality industry, which has returned to almost full employment, we've seen in senior living our employment level only return to 80% of where it was prior to the pandemic. And much of that has to do with the challenges with childcare and caring for other family members as our coworkers are trying to care for our residents. So it revealed a lot of weaknesses and challenges within our political and social support system within the U.S. that I think we're kind of beginning to show through, but we're really highlighted by this. I talked a little bit about ageism, but although people age, and this is a statistic from December of 2020, so my apologies that it's a little bit dated, but people age 65 and older made up more than 80% of the deaths caused by COVID-19, yet younger adults made up the largest portion of cases. So what does that say about who's responsible for the spread and yet who is dying from it? And I think when we look at this scenario of, and I often said this as the mother of a 5-year-old, if this were a disease that were killing our children of school age or preschool age, would people have taken this more seriously? Would mask mandates have been questioned? Would it have become as politicized? Would lockdown orders have been fought with such energy? Or would more Americans, especially parents, have thought more heavily about their vaccination status? You know, I think some of the challenges of ageism in our country and our culture were very much highlighted by this. I talked already about telehealth, but less than 76% of medical providers had a telehealth strategy before the pandemic hit, and much of that had to do with a lack of reimbursement for telehealth. And so our insurance companies and Medicare as well were not reimbursing for telehealth. And even though we've known how to do it safely and securely for many years, I mean, goodness, we're doing this on a live broadcast, right? But we know there are secure ways to do a FaceTime call or something similar. And we know how much our healthcare system has become digitized. And yet telehealth still was such a rare thing until the pandemic, when those regulations and the reimbursement for those services were loosened and thought about. And the great thing that's come from that is that many of those regulations continue to be loosened and will remain loosened because we've seen the equity that telehealth has brought to our healthcare system and the cost savings. So as I mentioned, we'd been using telehealth for quite a long time, but we were really pleased to see it expand because it means more access for our residents and more access for everyone to receive care at home and not go to the emergency room where they may receive care that is perhaps not personalized because that provider doesn't know them the way that their primary care provider does, or care that exposes them to other things while they're in that setting. But that delay in the regulatory adoption of these types of technologies has cost our system more money and has also probably cost people lives, especially in rural areas where they weren't always able to access great care. And then isolation. I think I spoke a little bit about just the social emotional impact of that isolation, but the cognitive decline And even physical decline of some of our residents has been very real. We've seen, muscle deterioration because they haven't been walking around our community and, coming out to fitness classes the way that they once had, although we've really worked hard to regain that. And we really thought a lot about how important our senior living social model is because, interestingly, once we got vaccination and once we felt that we really could confidently say we have this under control, the need and the people who wanted to move into our communities was very high because so many older adults were living at home in isolation and didn't have even someone coming to their room to check in on them in the morning and deliver their meals and say, how are you feeling and can I walk you through an exercise even in the hallway? So the benefit of the socialization and that social model, we've seen studies done about the social determinants of health that affect people's ongoing health as they age, and mental health and well-being, we know, are heavily affected by our need to connect with other humans, just in our innate nature. So our seniors who are living at home were certainly affected by this, and I think we all need to be cautious about including them in our communities and making sure that we're reaching out, and especially from this church community, ensuring that those who have been isolated are reconnected to our larger community. And then we talked about the politicization of COVID, but all those challenges that we've had, I think we've all seen people at school board meetings fighting the mask mandates at schools when kids haven't even been able to get the vaccines and can't be protected in any other way. It's particularly heartbreaking for those of us in healthcare who are trying our very hardest to protect everyone. And when we see that fight against the things that we know work and we've seen work, it's a hindrance to us getting back to expanding our economy and continuing to be a healthy nation, but also just getting back to normal life and the lack of anxiety that we used to know prior to this. So we know that the masking and the physical distancing and the sanitation and the vaccines, those are the way that we get back to normalcy, and we hope that people continue to choose to be on board with that. But the virus also has changed over time. I can tell you that from seeing outbreaks in April of 2020 to seeing outbreaks in November of 2020, again, by that time, very in control of things with testing and with masking, but again, our secure memory support residents still remained a very vulnerable population because they didn't physical distance or wear masks. And again, some of these folks were going out to their doctors and going out to the hospital, and there were points of vulnerability that we couldn't control. And one of those was also them being close to one another, not distancing and not wearing masks. And I can tell you, though, that the virus that we saw earlier on with those outbreaks and the virus that we saw in November and December of 2020 was extremely different. We had leaders who led campuses that went through the outbreak in May and then moved to a different campus and saw a different outbreak in November and said, this is a completely different virus. This is absolutely mutated. It is 100% more contagious. I cannot believe how different it is. And so the less that we are able to do to slow it down, the more we're going to see it mutate and continue to find ways to infect. And I think that we, as a smaller case study, saw what the larger public wasn't seeing in our small controlled environments. We saw that mutation over time, and we saw that highly asymptomatic spread that the larger public wasn't really privy to. And I think sometimes it was frustrating to us that the government didn't highlight that more, that even if you're feeling well, you should still not go out without a mask because you could still be spreading something that could be deadly to people that you care about. One of the really bright spots for us that we're quite proud about is that while we were able to establish some of those specialized units for people who were infected or exposed, we also were able to bring in monoclonal antibodies before almost anyone. We were infusing the monoclonal antibodies in our settings before the hospitals were in many situations, and we continue to do so. We recently had a small outbreak at one of our settings right before our residents were about to get the boosters. You have to remember, we were some of the first to be vaccinated, And we were so glad for the boosters to come around because we were starting to see a breakdown in the immunity, and we were seeing that need for a boost, especially with our frail older adults who may not have mounted that same immune response as many others would. And when we saw this smaller outbreak happen a couple weeks ago, we were able to bring in the monoclonal antibodies and infuse anyone who was exposed or positive, and we infused over 60 residents who had potential exposure or positivity, and we had one resident who was already very ill who did pass away, but it was because they could not get the antibodies because they already had so many complex needs. So everyone who received the antibodies is well and recovered, and we, as far as we know, we're one of the only assisted living facilities and chains in the entire country that has utilized that tool. And we're very lucky that we have a medical directorship team that has partnered with us on that, but we really feel that the monoclonal antibodies have been a game changer for us and help us feel even more confident in battling this. As I said before, we all know masking works and that vaccines are very safe and highly effective. I can tell you that from a group of people, from over 2,000 of our coworkers who received that vaccine in January or February of last year, we've had not a single coworker in the hospital from the vaccine or seriously ill, but I can tell you we've had them in the hospital because of the virus, even younger people. And that has been very scary for us because we want to protect our coworkers as much as we protect our residents. So the vaccines, speaking from someone who just had her booster, I can tell you, you may have a little bit of an immune response, but other than that, we're feeling very safe and very good about the vaccine effectiveness and safety. And then we know that those age-old infection control strategies work, from ramping up our hand washing and our mask wearing and all the things that we did with our ventilation systems, which I'm thankful Michael and our other leadership allowed us to do. Right now, the government is giving grants to other assisted living facilities for putting in air purifying systems, and we did that over a year ago. And we saw that really play a role in helping to stop this virus in its track. But also, it's had us think about what other strategies we can take in the future to continue to prepare. And we're glad to have partnered very closely with Penn State Health and other hospitals in our state who've looked at opportunities to really look at the health of our older adults as a community and not just a facility, and look at the whole healthcare system in trajectory of ways that we can partner in these emergency situations to support one another. And that is something really positive that's come out of this pandemic, is that we feel a closer partnership with our healthcare systems. We feel that they understand our capabilities and our challenges, and we know that we have their support currently, ongoing, and in the future should we have another challenge. But it was also interesting to see that direct correlation between the way our larger community is spreading the virus and the way it affects our senior living communities. And so when we talk about public health, you'd no longer go into a bar and smoke because our laws now prevent you making the decision about other people's lung health for them. And so when we look at this virus, it's really no different. It's not our decision or our right to be able to infect other people with this virus. And we've seen when the spread in a community or a county, as we've followed very closely because of our regulations, when we've seen a county spread increase, we've seen the case count increase within our own communities. And so there is definitely a correlation. We don't exist in isolation. Our residents go out to get their hair done, they go out with their families, they go out to the doctor, they go out to the grocery store. They're living in our communities. And it's really our duty to protect them in our actions as a larger community. I already mentioned our herd immunity within our communities that we're proud of. We know we can protect them when they're within our walls, but we're very passionate about encouraging others to protect them when they're within the walls of our larger community. And then I talked about our coworkers, the people that exited the workforce. It's the women who often have childcare needs, and we've seen a lot of our childcare systems really be challenged. Many of them are privately owned, independently owned by a small owner, and many of them actually shut down in the beginning of the pandemic because even shutting down for a few months, they were not able to survive as providers and businesses. And it was really sad to see that infrastructure began to really crumble because so many of our coworkers and many women rely on that type of support so that they can be a part of our economy. And I mentioned that our workforce is female and of a childbearing age, and so they were heavily impacted by some of those challenges. As we look in particular at Pennsylvania, which is the third oldest state in our country, I think we really have to come to terms with what types of supports are in place. Even though we've seen a lot of senior living providers opening across Pennsylvania over the last 5 years, we know it won't be enough as our older adults age, and we also know that not everybody can afford to live in a community. Not everybody has an adult child to help them make decisions or help support them, and as a community, we need to look at ways to support our older adults and ensure that they aren't isolated, that they have the resources and support that they need, and that we make sure that they have access to health care and a safe living environment and all the things to have purpose and well-being. And that's going to be a real challenge for our state as we look to the future. And as a country, I think that I originally gave this presentation 6 months ago, but since then things have only become more challenging with our workforce. And as we look at our older population increasing and our younger working population decreasing, our workforce is challenged. We see inflation. We see, for hire signs almost everywhere we go. And we know that there's going to be a breaking point where we need people to do jobs, and we need people not only in healthcare, but across our entire economy to do these jobs to support from the bottom up. And we see, immigration, infrastructure, and healthcare all intersecting in that challenge. And hopefully, we see our federal government taking some steps to supporting that, but I think our state in particular is going to need to look at opportunities to support that. But overall, I think one of the most heartwarming things for Michael and for me is seeing the hearts and the minds of our caregivers continue to show up and love and provide every day for our residents, and continue to sacrifice and to put themselves, really in the line of danger sometimes. We had people who volunteered to work in our COVID positive unit, and I can't think of a single one of them that ever got sick because they were so cautious and they had the tools they needed to be safe, but they put themselves in the line for our residents because they love them and because that's their calling. And when you see things like that happen and you see people continue to step up, even despite all these challenges and the length of this pandemic and sometimes the challenge to find hope in all of it, you find hope in the people who are stepping up. And it's not just our healthcare workers. Those of us who are going to the grocery store during this, we saw people continuing to work and show up and keep people fed, and teachers, going through so many hoops to keep our children educated, and our first responders and policemen and firemen continuing to show up, our retail workers continuing to show up, and just those decisions that people make every single day to show up and be there for their communities is what has given me hope that humanity still exists. And those who've taken the crisis seriously and been very careful and participated in those infection control measures and been thoughtful about what risks they take. And just new levels of flexibility and creativity in our workforces and in our families and in our communities. We've seen people step up and take on things because they know it's the right thing to do right now as we face this crisis. And when I take a step back and think about it from a Christian perspective, I think we have opportunities in this time of moral and ethical challenge to think about what it means as a Christian community to love and serve our neighbors. What does it mean to be interconnected into the Christian community and to our larger community? What is our role in public health and how we make our own personal decisions, but with the mindset of how our decisions affect those around us? And when we consider how we treat our elders, our prisoners, our poor, and this Bible phrase came to me in reading some of the essays about Christianity and the pandemic, and The King will answer them. Truly I tell you, just as you did it to one of the least of these who are members of my family, you did it to me. So I think we have opportunity as Christians to think about our role in helping people see that humanity is still alive and helping people see that we are still there to help our neighbors and to be an integrated community and to reach out and connect one another. And even the least of these, those folks are people that we can bring into our Christian community. So I thank you for the opportunity, and certainly it's been an honor to lead this organization, but it's been a challenge as well, and I hope that we get through this very soon. But even as we slog through, I stay full of hope and, really I feel blessed because I think we've had opportunities that others haven't to ensure that some of our most frail older adults and community members, we've had an opportunity to protect them. And that's really been a blessing for me as well. So thank you all for your attention, and I'd be happy to answer any questions or have discussion around any of this.
What food service and dining hall challenges have you had over the length of the pandemic?
Well, our dining directors could tell you they've had to pivot so many times they're not sure which direction they're facing anymore. But I think in terms of dining, we've seen challenges with having to serve in room versus in our dining areas and having to look at spacing and keeping people separated and safe. But more recently, we've really faced a lot of supply chain issues. And I think that we've seen that as challenges happen with populations that, again, are vulnerable, like in our meatpacking industry, we've seen supply issues there. We've seen prices wildly fluxing, and we've had situations where even, we see the supply chain in California with the ships coming in and the lack of drivers causing a whole backlog there. We've seen a lack of drivers in delivering our food, even on a weekly basis, being a challenge. But I'd say that overall, the dining experience is something that we've been able to return to almost complete normalcy with safety measures in order, and it's been a wonderful time of socialization for our residents and a time that they really cherish and fought to have back with one another.
Have you ever had to shut down the dining hall, or would you just keep social distancing?
Well, back in early 2020, when our residents had to stay in their apartments for several months, we had to serve all of their meals as room service. And so they were not able to go into the dining rooms at all. We were able to return to that after several months and did it with distancing, and we're still distancing.
Imagine there's staff challenges when you're serving everybody in the rooms.
Yes, we were very blessed, I think, as an organization that we'd been working really hard on supporting our coworkers even before this pandemic hit. And so we really didn't have any staff challenges through 2020 and through the height of the pandemic. We were very lucky to retain almost all of our staff. We saw more challenges happen in 2021 in the second half, and absolutely. I think one of the challenges was that some of our dining staff are younger people in high school, and some of their parents didn't feel that they wanted them maybe in our setting any longer because of the vaccination. Maybe they didn't believe that that was something that was safe for them. So we've had some challenges with some of our younger folks, but then we've had amazing younger folks who've been with us for years who continue to show up and love their residents and be there for them.
In response to the isolation that people experienced, the residents experienced during the heart of the pandemic, especially last winter, a regulation was adopted to provide access for community caregivers. Would you mind commenting about that?
Sure, that's a good point. So even though we had visitation, essentially shut down, there was a real understanding by the federal government and the state government that isolation and lack of socialization was detrimental for our residents. And so if they had one or maybe two family members who would agree to ongoing testing, would agree to safety measures, and would agree to visits within certain visitation hours, they were able to come in ongoing, even despite the visitation challenges, and they were able to still visit with their loved ones. And that was something that Medicare even recognized for even skilled nursing facilities. And it's been interesting to watch the perspective of our government and the CDC on how heavily that socialization weighs in importance, because now we've come full circle where they say you cannot restrict visitation at all anymore. You actually must allow even your skilled nursing facility residents to have visitation ongoing. And I think you may not even be able to restrict hours anymore, which we haven't done for a very, very, very long time, almost a year. But yeah, they've really recognized the importance of socialization, and they allowed those opportunities, even during the height of some of those visitation shutdowns, to allow for that socialization.
But do visitors have to be protected?
Visitors have to wear masks.
Must they be vaccinated? Just masks.
Yeah, and that's a challenge. You know, our skilled nursing facility and the hospice that we run, and you may have seen that President Biden put out the mandates for any organization that was getting Medicare dollars, and we move forward with that mandate, and now our settings are fully vaccinated in our hospice and our skilled nursing facility. And yet it's concerning to us that visitors are not required to show a vaccination card or require ongoing testing. But we feel very confident in the protection of masking and how heavily that has worked for us, and has worked even for vendors coming in, because we've had people who have tested positive and we've seen no spread because of the use of PPE. And so, you know, I think when we balance the need for socialization with that smaller risk, as long as people are wearing masks, we have limited visitation to our residents' personal private apartments. And so their loved ones can only visit with them in their apartments, not in the larger community areas where they might, could potentially expose another resident. But if they're wearing their mask, and families have been very, very respectful of that. I don't think we've had really any challenges. Just like you go into a hospital or a doctor's office now, you're required to wear a mask. We're still a healthcare setting, and people have been very respectful of that, and we have not seen a single case from a visitation that we've been able to trace back to a visitor.
99% vaccination rate for residents is phenomenal. How did you accomplish that?
Oh, I don't think that required too much persuasion. It was more about access. So we worked very hard to ensure that we had the vaccine available to them, and that we had booster clinics available to them, and that we organized that very well. And even residents who received the antibodies, they weren't eligible for the vaccine for 3 months, but we made sure that we brought pharmacists back and got the vaccine as soon as they were eligible. But it's interesting that residents really, for the most part, had no concerns about getting vaccinated. They knew that was scientifically proven to protect them, and they were very much on board with it. We just ensured that they had access.
Has it ever been considered to have on-site childcare for your employees? I know you probably don't want to get into that.
Oh, it's funny you ask. We used to have it many years ago. Yeah, we used to have it, and I would say it's an area that we haven't found ourselves to be expert in, and we've kind of tried to stick to our expertise, because when we try to go outside of there, we find that yeah, it stretches it. But what we have looked into is opportunities to partner with other local child care organizations. And what we did do, we have a 501c3 nonprofit organization called the Coworker Foundation that we utilize. Historically, we utilized it to provide grants to coworkers who were in trouble. Maybe they lost their apartment because of payments, or maybe they had a huge utility bill they didn't expect, or a death in the family that they couldn't cover the funeral costs. So we've provided grants to them in the past, but actually when the pandemic hit, we looked at the bylaws of the foundation and we expanded them greatly to cover childcare costs, to cover a hotel if a family member or a household member became sick with COVID and you wanted to not live in the house so that you could continue to work. Because if you have a household member, even if you don't get sick, your time out of work is longer than if you were testing positive. So we've put people up in hotels. We've also had coworkers who've been willing to go work at another campus when they've had an outbreak or a challenge, and we paid for hotels. And we also, all throughout the pandemic, almost every single week of 2020, we sent out pantry bags with sanitizer and infection control chemicals and groceries and toilet paper and paper towels, because we didn't want our coworkers to stress about the things that they needed. Yeah, and sometimes it was hard for them to find some of those basics. And so we knew that, you know, we were making big purchases as an organization, so we had priority access, and we made sure to share that with our coworkers, and we really expanded the foundation's reach so that we could support them, and we plan to continue to do so. And certainly, as people have had challenges with childcare, we've looked at individual situations and supported people with that.
That's wonderful. Too bad we can't have this publicized in the news, you know.
Put it on the YouTube channel, you know, maybe it'll go viral.
Maybe Fox News could be invited. I'm sorry, that's a little side.
I was going to say, while we've used a number of pharmacies for vaccinations, we might want to give a little a plug for our local pharmacy here that's been really outstanding.
Absolutely, yeah. Well, we have a couple people that have really helped us, and I will say that Hershey Pharmacy has been a great resource. And as we looked at boosters, not a lot of groups were really offering those. And although the vaccines were sponsored by the federal government to have CVS and Rite Aid come out and support us, the vaccines were not organized at all by the government, and it was sort of a free-for-all. Find whoever you can to help you. And Chuck Cray and the Hershey Pharmacy team absolutely stepped up and contacted us even before the vaccines were available, the boosters were available, to say, we'll be on site, you let us know when, and as soon as we have them, we'll be there to vaccinate your staff and your residents. So we want to say a big thank you to them.
Nice job.
That's all I have. If there are no further questions, they can leave them in the comment section. Thank you.